Good morning, everyone. Thank you for joining this morning. My name is Elizabeth Medina Kramer. I'm the Director of Operations here at Mexican, and I will be the one hosting today's meeting. I do apologize if there's noise in the background. My daughters are here with me as well. I hope everyone had a great weekend. Thank you for taking the time to join us this morning for our Latino Health Alliance meeting. I will pass it on to Vencio to say a couple words before we get started.
Muy buenos días. Good morning, everybody. Happy to be here with you this morning. And thank you, Maria Elizabeth, for hosting this meeting. It's always a pleasure to be here with you guys every month and talk about what's happening in the state of North Carolina in terms about the health. We had some exciting things happen here in Amiscan. One thing that I want to kind of let you know that we are organizing our second annual Latino Health Equity Summit, which is under the framework of the NC Latino Agenda. And this year is going to be June 14, and it's going to be up in Charlotte, North Carolina. Thanks to our partner, which is going to be the local health department in the area, has invited Amiscan to host the NC Latino Agenda Latino Health Equity. So we look forward to some of you guys to attend and participate in this conference. This year, it looks like we're going to be hosting two conferences around Latino health equity. One is going to be in the western part of the state, and the other one is going to be in the eastern part of the state. So we look forward for our speaker today and updates from everybody that are here in this meeting. So thank you, Maria Elizabeth. I hear back to you.
Thank you. This meeting will be recorded, as all you know. It will be shared in our NC Latino Health Alliance newsletter. If you would like to join that, please let me know and I'll share the link. Now I will pass it over to our guest speaker, Rachel. Rachel, if you could please introduce yourself and you can continue with your presentation.
Definitely. And if you could give me the ability to share again somehow, that I got lost. Hi, everybody. I'm very excited to be here with you. My name is Rachel Galanter, and I work as a technical assistance and consultation lead at El Futuro, where I try to support the expansion of mental health access for Latino people, both by supporting lay people, volunteers, promotores de salud, in building their skills to talk about mental health, and by working with agencies that want to do better, providing mental health support to Latino people. So I'm going to talk a little bit about the things El Futuro is doing right now and things that you could partner with us on if you're interested. And if you have any questions, I'll be happy to answer whatever questions. So as many of us know, the population of Latinos in North Carolina grew really rapidly over a short period of time, with North Carolina being the state with the most growth between 1990 and 2010. So a 20-year period where there was a huge amount of growth. And El Futuro founded its first clinic right at the sort of middle of that. The first clinic opened in 2005 in Scarborough, so we're in our 20th year. Our clinics right now, we have one in Siler City and one in Durham, and Durham is the bigger clinic. Our staff has really grown over that time, from a staff that was less than 10 people to a staff of more than 60. And that has allowed us to serve more people. So in the past year, we served more than 2,500 Latino people with over 17,000 sessions. And as a result, 92% improved in their ability to function socially and in their families. And we saw a significant increase in people's ability to just be stable and not have their mental situation get worse. And that this amount of service is more than we offered the year before, and that in addition to the services that are available in the clinics, we are able to provide people services virtually, so that once somebody is a client, if they can't come into the building and their preference is to get telehealth, we can provide that service. And we're doing all of this because we want to nurture familias to live out their dreams. And we do that with confianza, building that trust between the providers and the person getting services, but also trust between our agency and the community by supporting resilience, helping people find a way forward after things that have been hard. With calor humano, that people don't just get treated like a widget that is there to be fixed, but they're greeted as a person, they're offered a cafecito, they're given a chance to connect and feel like we're seeing the whole person. Pertenencia, helping create a place where people feel belonging, both inside the clinic, but also with some community events we have outside the clinic, and creating a place of belonging for our staff. And then comunidad, really being part of the community and joining with the community and helping the community's voice be heard. And our big goals are that there will be more mental health and substance use treatment available for Latino people in North Carolina. And I use Latine because I want to be as inclusive as possible. When I'm meeting with a person, I don't call somebody Latine, I call them how they want to be called, whether it's from their country or if they prefer Latino or Latina, but I want to be inclusive of anybody regardless of gender. And then our second big goal is to be a national model and a resource center so that we can support other people, both here in North Carolina and beyond, in doing this important work, because we're never going to do it all by ourselves. So if somebody needs services from our clinic, what could they get? They could get individual treatment, they could get group treatment, they could get family treatment, they could get access to therapy, they could get psychiatry. We have a special program around ADHD, we have substance use services, and we have community health workers, promotores de salud, that are trained specifically to talk about mental health. We have case management to help people with connecting to other resources. And our groups, some of them are just for our clients, and we have some groups that are open to the community. When we're doing therapy, we're doing things that are based in evidence. So cognitive behavioral therapy, trauma-focused cognitive behavioral therapy, cognitive processing therapy, trauma-sensitive yoga, eye movement desensitization and reprocessing, structured psychotherapy for adolescents responding to chronic stress. All of those are really focused on helping people heal from trauma, because so many people experience trauma that led to them immigrating, or during the process of immigrating, or here on the other side because of anti-immigrant sentiment, or because of the difficulties that have come with trying to adjust and acculturate. And so we offer a lot of services that are about trauma, but we also offer motivational interviewing, which is about helping people build the ability to follow through on their own goals, in addition to medications through psychiatry, if that's what people need, or support building skills around a specific situation like substance use or ADHD. When I talk about acculturation, there's a stress that comes from trying to merge two different cultural experiences into one person. And then there can also be gaps between different people, especially if there's staggered migration in a family where one person comes over and then another person comes over later. So one person's become more accustomed to this culture and acculturated more than the person who comes behind them. Or when there's an adult who grew up somewhere else and moved here, and a child who's pretty much grown up and only known this culture. And that stress from acculturation and the gaps between people can cause family conflict, depression and anxiety, cause a poor quality of life. It can cause problems with your physical health. It can cause low self-esteem where you feel like you don't have value. It can cause a risk for suicide. It can strain family connections, and familismo and those family connections is so important. And people can cope with all of that with substance use, and it can result in risks due to substance abuse. And when we look at what we see in the clinic, we see that mostly we're seeing people with depression, trauma and stress, substance use, and anxiety, right? Those are the 4 main things that we see. So we're really seeing the results of that trauma and acculturation, stress, and gaps reflected in the diagnosis we see. We also see a significant number of children with TDAH, ADHD, and then we see a few other things. And I know people think mental health, they think somebody who's seeing things and misunderstanding reality, who's having psychosis. And you can see that's a tiny, tiny amount of what we see. It's the least common thing, even though it's the thing people worry about the most. Places like El Futuro are essential because we are addressing one of the things that many of you know, that Latina people are 3 times as likely not to have health insurance. And so they can't just go find a therapist or go to the doctor necessarily very easily because of that barrier due to lack of health insurance. There are lots of other places people seek support. It can be traditional healers. It can be promotores de salud, which is one of the reasons we're really proud to do training and support for that community around mental health. People, other than finding therapy, might get a lot of support from the places in the community that they go, like schools and churches, where they find somebody who can give them emotional support. They might also just get emotional support from other kinds of activities, whether it's a football team or a group of comadres who come together, or being able to go and do a Zumba class with the same people. And that may be where emotional support comes from. So I don't want to say just because people don't have insurance and maybe aren't getting traditional support from a doctor or a therapist around their mental health needs, that they aren't getting support. But also sometimes you really do need more than just you need some extra help unpacking your mental health needs from a trained therapist, and we want to make sure that's accessible. In Durham and Siler City, we have a walk-in clinic where people can get a screening and get more quickly placed with some support from us, whether it's immediately getting into a support group or getting assigned a therapist. But this is the quickest way to get support from us. If somebody has insurance, we do not serve people with private insurance because there are so many people who don't have insurance. We serve people who have no insurance, who have Medicaid or have Medicare. Depending on where people are, we may have grant money to support them, or we may be asking them to, if they have some financial ability, to give some support, but that there's no insurance billing through El Futuro other than Medicaid and Medicare. If you have insurance, we can connect you, or we can support you in looking for a therapist, but that you have other options, and we want El Futuro to serve people who don't have other options. So one of the groups that we serve is people who are either are people who are mandated to get substance use services, but we try to prevent that with our substance use program that focuses on Latina youth. It's a simulation program that helps people see the risks of substance use. We also offer prevention workshops for adults about the early signs of substance use so that parents are on the lookout to make sure that their youth are on the right path. And then We have a 4-part workshop for high school students about the negative effects of and consequences of alcohol use, in addition to providing substance use treatment for people who have a driving under the influence charge and need to get both treatment and volunteer hours. We help them with the whole process. So that's one program that we offer the community. We offer a lot of groups. Some of our groups are intended for people who are already clients. So if you come into that walking clinic and you're experiencing depression or anxiety, we have Dale, which is an ongoing group that meets every week for people with depression and anxiety, so that they're able to get support from each other and as they're waiting to get a therapist. We also have Valor, a group that is for women who've been through trauma, where they're forming a community and supporting each other in addition to the support that they get through therapy. We have a group for parents of adolescents called Lazos Fuertes, and those topics are picked by our Youth Advisory Council, who helps determine what they think that parents of adolescents need to be aware of. We have Arte and Alma, trying to help support people through therapeutic art experiences, and we have other groups that we add as necessary. So our LAYA group, the Latine adolescent and young adult group, is run by an advisory council of youth, and it is both a prevention program where by being part of this effort, it's protecting their mental health, and it's helping that group make plans for how to support the mental health needs of parents and caregivers. And it's a way to incorporate youth voice. The advisory council helps us with determining social media that we will use to help spread messages about mental health to youth, as well as having a group that does some outreach to help youth learn more about the support that's available to them. So I did mention one of the open groups is our Lazos Fuertes. That's for parents of teens and teens. It's free. It's every month. You can register by Zoom. It's 100% in Spanish, and the LAI Advisory Council members determine the topics. If you scan this code, I think it will allow you to register, even though we've passed the April 17th deadline, I think it'll allow you to register for the one in May. Or you see at the bottom, it says that you can text at that number 919-670-0145 with the word Lazos to join this group. Our services that are open to the community around ADHD include 8 free virtual classes in Spanish for parents of children with ADHD. And those classes include psychoeducation, parenting strategies, how to best communicate with the school, and it really helps parents to decrease isolation. And you can scan this code, this little QR code here, or you can send a text to 919-666-7282. So many parents who have children with ADHD worry that people think they're raising their children wrong, that there's something about what they're doing that's causing the ADHD, and they don't really understand how to best support children with their behavior instead of punishing them for behaving badly. So this is an opportunity for parents of children with ADHD to come together and learn and practice skills and be supported by each other. As part of this ADHD program, we have a bilingual culturally responsive guide for teachers and parents that's available for free. And we do training in the community about ADHD, both for providers and for parents, so that we can help people understand what this diagnosis means within the community. Our open groups are one way we try to touch the community and reach people beyond people who come to the clinic. Another way we try to reach people beyond the people who come to the clinic is we have a green space right next to the clinic. It's a therapeutic garden. It has a sensory garden in it. It's a place where people can plant seeds and harvest. It was designed with the community, and it was really important to the community to have a water feature. You can see there's a little creek that runs down the middle where they can come play with their children. For a lot of people, it reminds them of the ways they played growing up, and it puts them back in touch with the energy and happiness of their childhood, as well as giving them a way to play with their children the way that they played when they were little. The mural was designed with the community and really represents some community voice. It's a very healing space. It's also a way to make it less uncomfortable for people to start thinking about mental health, that if mental health is confined into the therapy rooms inside the building, it can be a little daunting, especially for people who didn't grow up thinking about therapy as something that a person might need to handle stress. And so it's a way to create connections between the clinic and the community. Also, nature is very, very healing. And so just spending time in nature can be a way for people to help manage their stress. We have events there. The events have both dancing and crafts and vendors, baile folklorico, so people can stay connected with their heritage, which is a real strong protective factor to balance out acculturative stress. So some of the things that are happening in this green space is upcoming Mother's Day celebration. We have an ongoing group of Niñitos de la Naturaleza, which is meeting in the space for moms and dads and little babies, like 1 to 2 years old, to help those children get connected to nature, that we're doing in conjunction with the North Carolina Museum of Life and Science. And people who are interested can give a text to 919-886-7656 with Explora. We also have a group that's meeting there every month to support breastfeeding and for moms with new children, and that people can come. It's meeting once a month through June, and people can call or text 919-886-7656. And then we, in addition to the Mother's Day celebration, have Earth Day celebrations. It's just a great way for people to get connected to their community, to celebrate culture, to feel a little less like your mental health and your general well-being are totally separate things. So those are the things happening in our clinical space, the ways that we try and support mental health. Any questions about those things before I talk a little bit about how we help other agencies support mental health? Okay. I'll keep going. I'll look for any questions in the chat afterwards. So the other part of what we do is training, education, and consultation services to build out the ability of North Carolina to meet the needs of comunidades latinas. And we do that through continuing education and training, through creating a network of people to support mental health, and trying to make the latest research available to the public. And we do that through 2 different programs, one more focused on training professionals around mental health, La Mesita, and the other, Alma, trying to advance access for Latina mental health. So our La Mesita network has over 2,100 members. It keeps growing. We have people from all 100 counties of North Carolina and 26 states. If you feel like part of your role is to support the mental well-being of Latino people and you want to stay in touch with other people doing that work, you can join the network. In addition to that overall network where people can post questions and get answers, we have different learning opportunities. We have monthly webinars. We have a learning cohort where you're going through a significant amount of information. We have a chance to do case consultations, and we have a biannual conference. So the monthly webinars are free. If you're a person who needs CEUs, you can get CEUs. Each month, the topic varies. We had to cancel our April webinar on substance use recovery, so that will be coming back because of a issue for the presenter. So that one hasn't happened yet. It will happen, but it hasn't happened yet. The one coming up is about community-based participatory research. So if that's something that you're hoping to do more of, is get community voice into planning and making decisions about the work you do. That might be something you want to attend. They're typically that second Friday of the month from 12 to 1:30. We also have recordings of them. So if for whatever reason that time doesn't work for you, you can get access to the information at a different time. We also have a conference every 2 years that brings together experts from all over the country for intensive learning around Latino American mental health. It will be virtual, so you can do that from the comfort of wherever you are, and that's going to be at the end of September. Here are some examples of past webinars, just to give you a sense of the range. Anything from ADHD to grief to higher education to thinking about anti-colonial healing to legal issues around human trafficking. It's really pretty varied. And we've been doing this for over 3 years. And if you join the network, you can have access to all those old recordings and might find something on a particular topic that you need more information about. These are all in English. We also have a 10.5-hour self-directed learning that's an opportunity for people to deepen their understanding about mental health and the Latino community. We have scholarships available for this. So even though it has a cost, if you don't have professional development funds or monies available, please reach out anyway. It's lamesita@elfuturo-nc.org. It comes with videos and readings and discussion questions. So it's something a team could do together or somebody could do individually. And because this is self-directed, you can do it at times that are convenient for you and your team. We also do echoes. Currently, we're doing a series of echoes in partnership with the TEACH program, specifically about autism in Latino communities. The point of an echo session is to get people a chance to learn something about a topic. So there would be a didactic around whether it's autism, or in the past, we've done them on different topics: grief and loss, acculturation and reunification, suicidality and self-harm, ADHD, LGBTQIA Latino people. But there's sort of a short sharing of some information, and then a chance for somebody to present a case where that topic is an issue and get input and feedback from everybody else. It's really an amazing way to do a deep dive. So if you have, as an agency, an interest in doing something like this, you could reach out to El Futuro. Just like we're partnering with TEACH, we're interested in partnering with people who have cases that they're working on actively and want to share and would like us to support them in the didactic pieces and being part of that panel of response to help people continue to get better at addressing mental health needs. The ALMA program is about expanding that access. So where La Mesita is training professionals who are working in mental health to better address those mental health needs, ALMA is about reaching things broader. And one of the ways we do that is we partner with agencies We help them self-assess. How are they doing around culturally and linguistically appropriate supports, and helping them think through what are their goals based on that assessment, and then helping them review policies that might need to change, providing them with training, just generally being their partner in the process of helping move that vision forward of better meeting the needs of Latino populations. So that's consultation with a whole agency or a program to enhance their ability to meet Latino mental health needs. It could be a mental health agency or a program that wants to better incorporate Latino mental health into the work they do. We also do training of promotores de salud to make sure that they are able to have some conversations around mental health. We do a model called the community resiliency model that helps with self-regulation and helping people both regulate their stress when they're supporting others so that those promotoras aren't getting so stressed out by trying to help somebody with a mental health crisis. Some mental health 101 about myths and facts, helping people have conversations to ask about suicide, to help prevent suicide, and then some simple motivational interviewing skills to help people engage people in moving towards following through on steps to make their mental health more stable. This training is something that we do in Spanish or bilingually, or for populations that are working extensively around the needs of the Latino community. So the goal is to make sure that those people in the front lines maybe don't have a lot of training on mental health, have enough training on mental health that they can have some conversations and help connect people to resources. That's a little bit of the work we're doing in that training and consultation area. Any questions for me about either the services we provide or what it is that we're doing in the community? What is the best way to connect organizations that you may be working with in La Mesita? I'm going to stop sharing for a second, and I'm going to put something in the link in the chat that for anybody who wants to join the network, this is the best way to join the network. We're going to be moving the network to LinkedIn, but right now that's not where it is. But if you join the network now, then when it moves to LinkedIn, you'll be able to go along with it. You can also, if you're on LinkedIn already and you want to join on LinkedIn, you can do that. Has El Futuro partnered with any MCOs to broaden resources and services? I'm really tempted to put Steffi on the spot around this, but that seems a little unfair, but that we are working on a deep partnership right now with Alliance around expanding access, particularly in Orange County. Justice United in Orange County worked extensively with the community to hear what were the needs of the community, and then use that community organizing to ask the MCO to fund more supports in Orange County, specifically through Promotores de Salud. So El Futuro has 4 Promotores de Salud community health workers who are trained in the Strong Minds, Strong Community model that are available to provide that 10-session intervention to Orange County residents. Steffi, if you want to add anything, feel free.
Nothing that I can think of. I know that maybe some folks are familiar with Strong Minds, and so there's a lot of excitement around that programming, and hopefully that's something that becomes more and more available across other counties. But right now, Alliance is solely supporting us in that work in Orange County.
I'd be happy if I send Elizabeth the slides, she can send them to everybody. Is that the best way to do it? I will definitely do that. I will share them with her.
Thank you, Rachel. Just wanna,
Oh, Erica, that'd be really exciting. So I'm gonna put my if you want to get up with me because you want to get more information about any of the training and education programming, or you have an idea of a place that we could do some of that consulting work with, I put my email in the chat. Yeah, Juvencio.
Rachel, thank you so much. Question is about the trainings. These trainings are you able to do those training in person or everything is online?
That's a great question. So the training we're doing through La Mesita is online and in English, and you get CEUs. The trainings that we're doing for promotores de salud and community members to expand their ability to talk about mental health, we have been doing those both in person and virtually. Sometimes we have grant funding to do them for free. Sometimes we ask people to support us with some of the financial, some financial support, especially if we're going to them. But we've been able to do some of it at no cost. And we've even gone and done trainings in other places. It's really, we do our best to make it really accessible to the people who need it most.
Thank you.
Yeah. I'm with you, Juvencio. Like I think people learn so much more in person, right? And you build that confianza faster. And when you're giving feedback and people are building skills, it feels very different. And like right now, like it's great to see you and Elizabeth and Erica, but like mostly I'm seeing black boxes with white names, and it's hard to feel connection and comunidad in when we're seeing each other that way. And so when we come together, it's really different.
When you do these trainings, let's say you do this series of trainings, three trainings, and they're going to in person. Have you done that before, or you always just doing online and that's it?
No. So, for example, we partnered with El Pueblo and we went to El Pueblo 4 times. We went to do the training 3 times, and then we went one more time and worked with them to get their input on some materials that we made for them so that they have handouts to help them in Spanish to help them use the information really well. And together we developed a little video that's to destigmatize mental health, that is promotores de salud talking in Spanish about how people might know that they need support and what are things you can do for yourself and what are things that you might need to go and get a therapist. So we're really trying to partner with people around these opportunities and not just stay where we are. So we've been to Charlotte, Greensboro, Raleigh, right? We haven't been super far, but we have gone and done things in person.
Thank you, Rachel.
Yeah.
thank you, Rachel. Are there any last questions for our guest speaker before we continue on?
I have a quick question, and sorry I'm not on camera. I'm under the weather today. But Rachel, quick question. I'm with Blue Cross and Blue Shield of North Carolina. We work with organizations across the state, and sometimes we hear similar things in communities, especially the need of behavioral health in Hispanic Latino communities. What's the best way to connect some of these outlying or some of these new partners that we may be meeting, maybe in the western parts of the state, in some of the eastern parts or more rural parts of the state with El Futuro? what's the best way to connect them?
Right. I think that for those people who are in really rural areas, the best and far from where there are a lot of services, the best thing is to connect them with our training, education, and consultation services. And so you could use my email, or you could help them connect to La Mesita, and through La Mesita, because we have somebody in every county in North Carolina already has joined La Mesita. So we can help them network with other people in their county or in surrounding counties. So I think through the La Mesita network or through my email would probably be the starting place. We're working on pulling together some things, some initiatives in Eastern North Carolina and Western North Carolina, and I could help them get connected to those efforts.
And I'll just mention super quickly, Rachel didn't ask me to say this, but we are also working on a new project that is more widely for immigrants across the state of North Carolina, not just Latina immigrants and community members. So that's something that is pretty new and we're still kind of defining, but we're hoping to establish a network across the state for folks who may not have the same background, like maybe folks who are working directly with immigrants, but also maybe folks who are supporting those that work with immigrants. And again, it's across all immigrant groups. We're still in the initial stages of defining what that network will look like, but as soon as we know more information about that, I'll make sure that I come back to this group with that.
Thank you. Sorry, I had a crying baby. Any other questions before we move on? Okay, if not, then we can go ahead. Once again, thank you to Rachel. I will be sharing her information as well in the newsletter with the recording and any of the slides that she shares with me as well. We will continue on with introductions and any events that our partners may have. I will go down the list. Starting off with Adriana Torres. I'm sorry, Adriana, we're having a hard time hearing you.
Can you hear me now?
Yes, a little bit better.
I'm Adriana, care coordinator with the outreach department with Kinston Community Health Center. So we have a couple events coming up where we're attending and taking blood pressures and sugars, sugar levels with our RN, Smilene and Karina. Our next event that we'll be attending is the, let's see, the Lenore County Employee Health Fair event from 3 to 6 p.m. We will be there, you know, expanding our resources to anybody that is in need of local resources or getting health care with us.
Thank you. I will pass it on to Erica.
Hi, my name is Erica Reynolds. I work with Trillium Health Resources, and I'm one of their newest health equity coordinators, working with the Latino and Native American populations. And we have a 46 county service area, and I am looking to partner with folks to offer outreach and you know, connect people to better resources. We serve uninsured and those with Medicaid or Medicare, or Medicaid specifically. And we're excited about the expansion of the tailored plan in the 1915I services and waiver. So yeah, so if you have any ideas, I put my email address in the chat. If you'd like to partner, please reach out to me and let me know. I'm super excited to be here. So thank you.
Thank you. Francisco Guzman.
Hi, good morning. This is Francisco Guzman. I'm with the Division of Child and Family Wellbeing at the North Carolina Department of Health and Human Services. And as well as Erica, I'm trying to connect with other agencies and community. We still are doing presentations on Medicaid expansion and Medicaid for children and youth. If you want to reach me out, I will put my information in the chat. Thank you.
Thank you. Humberto Salinas.
I'm sorry, I'm on my weather is not too good here, but I'm very excited to be here and to listen that there is a lot of need to be linked together, agencies and need from our community. I'm very excited to be here. Thank you, Elizabeth.
Thank you. Jennifer Lewis.
Good morning. This is Jennifer. I'm the outreach coordinator for ECU Health Cancer Care. Always happy to be a part of these calls and really enjoyed this particular message. As we all know, mental health is such an important issue in our area. So that was a great presentation. And again, I'm the outreach coordinator for ECU Health Cancer Care. We do free mammogram clinics once a month here at the Cancer Center for women that live in Pitt County that are over the age of 40, that do not have health insurance, that are in need of a mammogram. So you can reach out to me. I'd be happy to talk with you about that. Probably about 80% of our monthly clinics are Hispanic, and we really try to get that message out to our Hispanic population so they can get that much needed yearly screening.
Thank you. We'll pass it on to John Silvernail.
Good morning, everybody. John Silvernail down at the Caswell Developmental Center. If you're interested in working with the developmentally disabled, we will be having a job fair on Saturday, June 30th, and I can share more information with you for your newsletter offline. Thanks. Have a great day, everybody.
Thank you. Kay Rouse.
Good morning, everyone. Kay Rouse. I'm the Health Equity Manager here at ECU Health, and also work teaching in the evenings, ESL over at Pitt Community College. So I get to live a little bit of a couple of worlds here in Pitt County. But the work that I do here at ECU Health is out in the community, helping people to get access to care, as well as connecting them to various resources for food, housing, a number of things. So hearing this message today was very helpful. So we'll definitely be calling on you guys to get some folks, connected to that resource for sure. So thank you for having us.
Thank you. Josimar Garcia.
Hey everyone, this is Josimar Garcia. I'm the health educator at Kansas Community Health Center Outreach Department, and I work with Adriana Torres. So she had already given the announcements, but yes.
Thank you. Kelsey Jokovic. I'm so sorry for butchering that.
No, you got it. It's Jokovic. Hi, everybody. My name is Kelsey. I am the Community Voice Program Manager at the Foundation for Health Leadership and Innovation. We have lots of different programs that work for whole health with North Carolinians. And just a couple of announcements. We do have a legislative breakfast coming up next Tuesday, May 7th. I think that's a Tuesday. And everyone is welcome to that event. I'll put the registration in the chat, but it's just an opportunity to celebrate legislative leadership that's helped improve health equity for rural North Carolinians, specifically around mental health and dental health. So that's next week. And then our part of my job is leading the North Carolina Rural Health Association, and we have a quarterly meeting once a quarter. So our next one is going to be in June, and that'll be held in a virtual capacity or hybrid capacity in Halifax County and online. So if anyone wants to attend those meetings, I will send out the registration for that as well. That'll be on June 7th, and we will have a simultaneous interpreter at that meeting. So if there's folks who speak Spanish who want to join, we would love to have them as well.
Thank you. And next we have Leo Scaparti.
Yeah, hey everyone, again, Leo Scarpati with Blue Cross and Blue Shield of North Carolina. Don't have any events coming up at the moment, but Juvencio, I would just want to say I would love to know more about the Health Equity Summit that you have coming up. So I'll send you an email just to get some more info on that. Thanks.
Thank you. And next we have Mireya Alvarado. Okay, and next we have health. I'm not sure. And then lastly, Carolina Perez.
Hi, everyone. I dropped some information in the chat. I just wanted to invite everyone to our live streamed Spanish town hall tomorrow from 6 to 7. It's going to be on YouTube and Facebook. We'll be talking about cancer prevention, so make sure to check us out. We'll have Carlos Cano, who is a physician's associate, who will be talking more about the stigma around cancer, so particularly for our Latinx males. And we'll also have Dalia Antunes. She's the bilingual community-facing patient navigator for Duke Cancer Institute. So they'll be giving us some important information on that. And most importantly, I really wanted to stress the form to order a new round of Medicaid printed material. It's going to include coloring books, magnets, and a lot of really good swag to include when you're talking about Medicaid expansion. So I've dropped both of those links and information in the chat. I hope you can definitely take advantage of ordering material. I think they're going to cut that off possibly the 30th, so tomorrow. But just make sure if you haven't ordered already to go ahead and do that and fill out the form, and they'll be mailing those out at the beginning and middle of May. Thank you.
Thank you. I think I named everyone. If I did miss you, please, if you would like to share any of your updates, you can unmute yourself and share that information. Lastly, for us at Mexican, we do have a few events coming up, starting off with the NC Latino Advisory Council that's coming up on May 7th. That's next week. I will be sharing the job form for that. If you would like to attend, please be sure to register. We also have our health fair event in Duplin County. If you would like to participate and have a table out there, you could also register. I'll be sharing the link for that as well. It will be on May 18th from 12 to 3. And then also we'll be sharing any other evening meetings that we have coming up on our newsletters. And also I wanted to go ahead and share a drop form for our NC Health directory. We're trying to update our directory. So if you could please fill that out and we'll add it to the directory. And once everything's completed, we'll start sharing that directory in our newsletter so everyone can have those contacts as well. I'm missing one more thing. Oh yes, we will not be having a meeting for the NC Latino Health Alliance next month due to the last Monday falling on Memorial Day, and I'm pretty sure a lot of people will probably have that day off. So our next meeting will be June 24th at 11 a.m. And then also, if everyone has like 10 to 15 minutes, give me a thumbs up, or if you're not able to stay on any longer, we can share some updates in the next meeting. But I do have one of my colleagues here, Vanessa Rico, who has some information to share from a survey we had. It shouldn't take long. And if you have to step out, I definitely understand. It will be recorded and it will be shared in the newsletter as well. So I'm going to go ahead and hand it off to Vanessa Rico to present herself and share the presentation. You're on mute, Vanessa.
Sorry, I was muted. Hello guys, I'm Vanessa Rico. I'm a former intern with a Mexican, and during my internship, I developed a health survey to assess the Latinos in our community regarding health. And I'm gonna share my screen with you guys. Are you guys able to see it?
Yes.
Okay. So the purpose of our health survey was to evaluate the diverse health needs within our community and collect invaluable data for future health initiatives. We had 188 surveys from 15 counties. The participating age groups ranged between the ages of 18 to 64, with majority of them being 29 and 39. And here we have the graph. It laid out the exact amount for each age group. I also asked them their residency in the US. Most of our participants had been here less than a year. 30, 1 to 3 years, 9, 4 to 6 years, 8, 7, 9 years, and 10 participants, 10 plus years. I asked them how they would rate their overall health, and 38.8% good said good, 24.5% said very good, 16.5% said excellent, 18.1% said fair, and 2.1% said poor. I asked them about their chronic health conditions. 13 individuals said they had diabetes, 7 prediabetes, 9 high blood pressure, 2 high cholesterol, 1 heart problems, and 2 asthma. Here I laid down the health conditions and their related age. To the right, we have prediabetes. Most people were between the ages of 25 to 57 years old. Diabetes, 35 to 57 years old. High blood pressure, 29 to 62 years. And high cholesterol, it was 50-year-olds. And we can see how each condition is prominent in each age group. We asked them about their family history. 26 said diabetes, 8 said high blood pressure, 1 said pneumonia, 1 said cancer, 1 arthritis, and 1 migraine. I also asked them how often do they engage in physical activity. 30 individuals said never, 35 individuals said at least once a month, 69 said at least twice a month, and 40 said at least once a week. I also asked them how often they visited a healthcare professional for routine exams or checkups. 25 individuals said never, 38 individuals said rarely, 81 individuals said sometimes, 27 individuals said often, 7 said extremely often, and 10 left this question unanswered. I also asked them where they went for medical treatments like vaccines, routine exams, and screenings. Most of our responses said Continua Health, Bernstein Medical, and Dental. Other responses included Physician East, Hamilton Community Health Center, Greene County Healthcare, Healthcare Snow Hill, and their local health department. And I also asked them if they had a primary doctor. We had a yes, 4 yeses, and 140 no's. I also asked them how often they felt that healthcare was a financial burden. 49 individuals said never, 25 individuals said rarely, 75 said sometimes, 20 said often, and 8 said extremely often. I asked them if they had experienced stress or anxiety in the past month. 121 stated no, 36 stated yes, and 27 stated not sure. What induced the most stress or anxiety? 20 individuals stated their job, 30 stated their health, 4 stated their economy, 1 person stated overthinking, and 2 individuals stated their family. So here we see, job and money seem to be the most stress-inducing. I also wanted to assess your nutrition. So how many meals do you typically eat in a day? 3 individuals said 1 meal, 93 individuals said 2 meals, 83 individuals said 3 meals, 5 individuals said 4 or more meals, and 2 individuals, that was a typo. I also asked them if they would be interested in joining a diabetes support group. 90 said no, 36 said yes, and 45 said not sure. I also asked them which of these barriers do they face regarding health resources. 1 said cultural or religious barriers. 8 said lack of availability of doctors. 5 said fear and distrust. 11 transportation. 42 language barriers. 50 no insurance or not being able to pay for care. 51 said no barriers. 17 said they don't know where to go, and 53 said time. What programs, resources, or initiatives would they like to see in the future? And here I listed some of our answers. To name a few: dentist, food bank, financial support, language resources, programs for disabled individuals, health benefits, diabetes support groups, migrant support, continuing work opportunities, fertility specialists, how to start a business, after work hour clinic appointments, free doctors, and more health focused programs. And here's some of the takeaways. Diabetes is an ongoing, highly prevalent health problem in our community. The majority of the Spanish-speaking community does not have a primary doctor. People stated their job, health, and economy cost them the most stress and anxiety. And over half of the people surveyed eat 2 meals or less a day. Language barriers, lack of health insurance, and time are the common obstacles to healthcare. And thank you so much. That's all I have. I really try to make this as quick as possible. I know we're over time, but thank you so much. And if you guys have any questions or feedback, I'd really appreciate it.
Thank you, Vanessa. If there are any questions, please feel free. I know we're on a time crunch, as Vanessa mentioned. If you do have any questions, you are more than welcome to email us as well at the NC Latino Health Alliance email or myself at my email. And I will pass it to Vince if he has any words.
I want to say thank you, Elizabeth, and thank you, Vanessa, for showcases this assessment that you did during your time. And thank you, Rachel, for your great presentation. That was wonderful to see all the services and resources that you have in El Futuro. As Vanessa highlighted the assessment that we do it twice a year. And as you see on the map, it was done mostly in Eastern North Carolina. And we're going to do another one in the middle of the summer. We're going to do another one. And those assessments take place through our week of health and services that we offer in our community through partnership and collaboration with the Council of Mexico, which we assist over 600 people during the week. And that's what we do these assessments. People comes from different parts of the state for the services in the week of services. So that's what we try to utilize those individuals and participations on this. I think for organization, it's important to do assessments on a regular basis to see what the landscape of the community looks like. So thank you, Vanessa, for the work. And I'll say thank you again, Marilisa, for facilitating this convening. And I look forward to see you on June 24. And also stay on the look for the conference coming up on June 14 up in Charlotte.
Thank you, everyone, once again, and thank you for staying on a little extra time. I know we went a little bit over. We will share these slides as well in the newsletter, as well as Rachel's slides. Thank you once again for joining in, and I hope you all have a great rest of your week, month, and day. Bye, everyone.